And I'd like to thank Dr. Ungerleider for this wonderful opportunity. So as he said, shortly after I was born, I was diagnosed with tetralogy of Fallot. When I was 6 months old, I underwent the blaloactolysis shunt procedure, and then on August 25th of 1988, under the skillful hands of Dr. Ungerleider, I underwent my open heart corrective surgery. One of the stories that my mother likes to tell about my surgery is how when she saw me for the first time after I had had the procedure done, how she wept because it was the first time she had seen me with blue skin. I was finally oxygenating and I was finally having a normal heart. So what has it been like for me growing up as a child who had a repaired heart condition? Dr. Ungerleider gave me a wonderful chance at a normal life. Looking back at it now, the only limitations that I can think of were that that I couldn't play contact sports. And other than that, and having regular doctor's appointments for checkups to make sure that the procedure had gone well, I didn't feel that I was any different than any other kid. One thing that I do feel came about from my experiences was that I developed a profound sense of respect for doctors and the entire medical community. That attitude was instilled in me by my parents for their tremendous amount of gratitude that they had for the medical community who had repaired and cared for me for all those years. So not only was I given a normal life, but my life was given a direction and a purpose. For as long as I can remember, and my parents can attest to that, as long as they can remember, I've said I wanted to be a doctor. Around the time of middle school, I started saying that I wanted to be a pediatric cardiologist, just like all of the doctors who had cared for me. In high school, I was given the opportunity to write a paper on who I thought was my everyday American hero, and I chose Dr. Ungerleider for the chance at life that he has given me, and for the chance of life that he has given hundreds of kids and those families since me. While writing this paper, I took the opportunity and I tracked him down by the internet and I sent him an email. And we had multiple conversations over email while I was writing the paper, and hearing his stories and hearing his dedication only furthered my ambitions to want to become a doctor. And one thing that you have to remember is that that was the first time I had ever spoken to Dr. Ungerleider, was when I contacted him by email. And as he mentioned, tonight's the first time that I've seen him, and it's the first time that my parents have seen him in 22 years. So after that, I was in high school, and most of the time kids are starting to look at what colleges they want to go to in terms of which schools are party schools or which schools all of their friends are going to. I was more concerned at which schools had medical schools associated with them. I knew what I wanted to do. And so I ended up going to Virginia Commonwealth University, which is in Richmond, Virginia. And like most pre-medical students, I followed the line and I got my Bachelor of Science in Biology. It was actually in March of 2007, and it was the exact day, it was shortly after VCU men's basketball had defeated Duke in the NCAA men's tournament, that I learned that I had been accepted to the VCU School of Medicine, which most of you will know is the Medical College of Virginia. A dream of mine had finally come true. I was going to be a doctor. So 3.5 years later of medical school, I have an even more deeper appreciation for Dr. Ungerleider and everything that physicians and medical staff, nurses, anyone that plays any sort of role in the medical community. I have a much deeper appreciation of what they've gone through. When I entered medical school, I was fascinated by what the body could do and what could go wrong. During my clinical years, I had a hard time deciding what field of medicine I wanted to go into. I loved it all. But I always came back to pediatrics, and specifically I always came back to pediatric cardiology. The pediatric cardiology was always in my heart because it was what I knew I could relate to. So when I was in third year, I was on my pediatrics rotation, and I was working at an outpatient clinic. And I was fortunate enough to be able to work with a young boy who was about 2 years of age who also had tetralogy of Fallot. And he had not yet had his corrective heart surgery. I spent at least 30 minutes in the room with the patient and his mother, and talking to the mom about what my life had been like, what the life of my family had been like, trying to cope with a son who had heart surgery. And I answered as many of the questions as I could for her. And that was really, I walked out of that conversation changed in many ways. I hadn't stopped and thought about my life as a repaired tetralogy of Fallot patient in years. It was a great remembrance and meditation exercise for me, and it allowed me to see how far I've truly come. And it also cemented in my mind which direction my career needed to take. It was at that moment that I knew I had to go into pediatric cardiology. By going into pediatric cardiology, I would be able to give back for all of the wonderful life that I've been allowed to live. I was able to develop a relationship with that boy and that boy's mother that only few of us can, the few of us who have actually lived and gone through this. So neither my family nor I knew at the time of my surgery the impact that it would have years down the road. I feel that since I've experienced heart surgery, I have an ability to help patients and their families to cope and deal with things that myself and my family have had to go through. The trials and struggles of having heart surgery and growing up with a repaired congenital heart condition have come full circle. It's allowed me to be able to better serve my patients as I pursue my career. I'm proud to say that, as you mentioned, I've started my interview process for my pediatric residency with the ultimate goal of going into a pediatric cardiology fellowship. I'm so very thankful for all of those who have cared for me over the years, and I hope that as I move forward in my career, that I'm able to give back half of what they've been able to give to me. Thank you for allowing me to come tell a little bit of my story tonight. Thank you again to Dr. Ungerleider for everything that he has done for me, and I also want to thank my parents for all of their love and support who are here tonight with me. Thank you.